So thank you, Sushil, for inviting me, and once again, thanks to Akash and Dr. Pratap, Dr. Rutul, Dr. Sanjeev Phatak, Chair for RSDA Gujarat chapter, that they agreed that there should be some technology talk even after post-lunch also. So few things before I talk about my subject. One, that I congratulate Akash Singh and every one of you who could spare your very valuable time even after post-lunch session on Sunday to listen. So that's number one. And second, one very important disclaimer that usage of technology in our country is really very poor. Nothing can change the A1C of your patient. In last 25 years, there are so many new molecules have come. So many data had come. Scientific papers were published like anything. And they all shown in a randomized controlled trial significant improvement in every aspect of life. But still the average A1C of people is around 8.5. And this is not only in India, around the world. The only thing which had changed really is technology. And one of the most important technology is continuous glucose monitoring. There was a debate in ATTD, and actually I could not change my slide. This slide I have made primarily for advanced technology meeting which we had given a talk Amsterdam last month. There was a debate. Suppose you have money and one side you want to use patient GLP-1 and other side you want to use the CGM. Which will you use? I mean, everyone will say that GLP-1 have the evidence, it can decrease the weight, it will improve your cardiovascular life and all those things. But actually speaking, if you don't monitor, there is no point of action. If I don't know where I have to go, if I am not monitoring my national highway, express highway, whether it is going Ahmedabad or not, if I am just going anywhere, I may reach Mumbai. So unless I monitor it, there is no point of action. So monitoring is most important technology. And I can say that actually my practice is completely changed once we started seeing our patients on a continuous glucose monitoring. At that time it was AGP. And I'm sure those who have worked with me as my student or as a colleague, they also know that how it has really changed the way we were treating our patients. We can predict our patient that yes, your next after 7 days, your sugar will be absolutely normal. After 15 days, your 20 days, things will be fine. So ACP or continuous glucose monitoring really changed the way we treated our patients. If I see my patient prescription before 15 years of 2010 or 2008, sometime I feel, oh, I used to write this medicine and now things are completely changed. So what I am going to talk in next 15-20 minutes, the continuous glucose monitoring for lifestyle modification. And I will show some of the cases also. I don't have anything to disclose here. So lifestyle factors, there are multiple lifestyle factors which are responsible for our lifestyle and they are responsible for our glucose control also. So it's a diet, exercise, sleep and stress. All of them. One thing is, if you are starting monitoring yourself, you will change in your lifestyle too. Some of the facts which I had shown in ETTD, because this is the challenges. One is carb content in diet is very, very high. And that is really a big challenge for us to modify the lifestyle of a patient, because the fasting is absolutely normal, maybe 95, and suddenly you find that their post-meal sugar is 220. And this happened many times. You have a patient with a HbA1c of 8.5. And what you think that how an uncontrolled diabetic patient with a 8.5 HbA1c to be controlled? All guidelines will say the patient should be started on a basal insulin therapy, right? But when you do the continuous glucose monitoring, you will find actually his fasting or midnight of the sugar, patient sugar is actually 90. It is the post-meal sugar only which is contributing his HbA1c of 8.5. So probably he needs that change. The factors which are responsible, you will be surprised, more than medication, your HbA1c can be reduced by diet and exercise. More than your medication, you can reduce your HbA1c. I am talking of type 2 diabetes. So here we are talking of type 2 diabetes. It is a diet and exercise, and that's the reason. There is a possibility of reversal of diabetes. That's the possibility of completely you have remission. It was what? Your diet only. They have just kept you on a low calorie diet or maybe less than 800 or 1200 kilocalorie diet, and people have reversed their diabetes. This is one paper that how continuous glucose monitoring can motivate self-management and can motivation follow the behavior. So even if you use your patient CGM, may not be continuously, maybe only intermittently, still it will change their behavior because it will motivate them, and a continuous motivation will definitely change their behavior. And this we also have seen in GLP-1 therapy, because many of your patients will not continue for more than 6 months or 12 months. You start them and then they change their lifestyle, they change their behavior, and over a period of time, they continuously change this throughout the lifetime. This is one very interesting fact, that carbohydrate content of Indian diet is very variable. So the same patient, for 5 days his sugar report you can see, the other day it can become up to 280, and other day it could be only 140. Because every day the carb content of the diet is different, and at the same time how you are eating. So today suppose I have taken this rice with more amount of dal, the same amount of rice will give me less post-meal effect. On the other day I am taking this simple rice, maybe with a small quantity of dal or maybe sabzi. Or the other day I am taking a maida roti, maybe something which may increase my sugar more, or other day it will not. So the carb content and variety of food which we Indians have, which is not in like European or Caucasian population, well, we have very different varieties of food, and for them CGM is really very useful, because this will be very, very motivating. When you use CGM on your own, you will find that some amount of food will actually increasing your sugar level very high. So you want to change your food also according to once you use the CGM, and you will find that yes, if I go and take naan, then probably my sugar increases more, but when I take a roti and which is multigrain, then definitely my sugar may not increase that much. This is one, if you have 4 different varieties of patient and all of them have same HbA1c. Let us have all patients of them, these are HbA1c of 8. But they all have to be treated in a different way, because all of them cannot be treated as only HbA1c. You cannot make the criteria of their treatment. They may be on triple drug, all of them, or dual drug, but they all require the third drug will decide only on after seeing their glycemic pattern. You can see here, this patient post-breakfast sugar is very high. So probably, if I want to give him maybe something which can take care of the breakfast, post-breakfast sugar, or I have to change completely the diet of a breakfast of this person, and his probably post-breakfast sugar may control his sugar throughout the day. The other patient actually having same HbA1c is 8, but you can see here early morning actually his sugar is getting down. So he may not be treated with increasing his insulin level or increasing his sulfonylurea, because that may decrease his sugar early in the morning. The other patient is all 3 meals sugar is high. It requires only lifestyle modification to change his lifestyle or as far as the diet content. And the last patient is having actually only the post-dinner sugar is very, very high. So all 4 patients may have same HbA1c, but they all have to be treated in a very, very different way. That is what a same HbA1c, it's the glycemic pattern will decide for that. We have also done our survey on CGM. Our own patient, 90% of CGM user felt that its use contributed to a healthier lifestyle. So I mean, if you ask the patient to start CGM, they will deny because it is costing around 5,000 rupees. But when you convince them and when they come back, they will say that yes, it has really helped me for my changing the lifestyle. 40% of CGM users reported being more likely to go for walk or to do physical activity if they saw rise in their sugar level. Because nowadays it is a real time. 87% of CGM users felt that they modified their food choice based on their CGM use. So they will also change their, and this paper which we are publishing this time in ADA. Now let me show you some of the cases. This is a real world case. A 42-year-old male with a BMI of 28, first time detected with very high sugar with A1C of more than 9. Now, I am sure all of you must have seen such type of patient with first time detected with 9, patient is not ready to take the medication. You explain that 9 HbA1c, you have to get treatment. Now more than 6.5, there is no guideline is saying that you can't be on the medicine. At least start with metformin. Here you need at least 2 drugs, more than 8.5 ACE, ADA, everyone is saying. patient was not ready. He told, no, doc, you just tell me the lifestyle. I will change my lifestyle completely. I told it is low glycemic index, low carb diet, you have to decrease your calorie content, you have to decrease your weight, all those things I have written, and along with time restricted eating, because that helps him for weight reduction patient. And then I explained that why 9. So then I asked, is it the criteria HbA1c? No. I told no, let us do your CGM. And then I will be able to convince you more. So patient was in first 14 days. This is the report. And you can see here the report, please date wise, from 30th November to 13th December. This is the first 14 days report, and all sugar is high. I told, no, see, your all 14 days report is very, very high. You need to be on treatment. There is no point why you are wasting my time. He told, no, you want this to be controlled? Next time I will come with a better control. We put him again on CGM on the next report. You again see here report, 14th December. The same day we removed and we put him again on a new CGM. And again in 14 days, he tried, and he tried really good. You can see his time in range now 82%. So we were explaining him, actually any type 2 diabetic patient should have more than 70% of the time in range. First time I can show you report was 54%, was out of control, only 34% was time in range. The next time report had come with 82%. But still I was not convinced. No, you have to be still on treatment because you are newly detected diabetes. You should be having more than 90% time in range. You still continue to do it, and I still say you should be on treatment. Why you are not on treatment? Because you are a diabetic. He told, no, doc, I don't want. See, again 14 days. So same day we removed and we had put third day. Now this is the 28th December, from 14 to 28. On 28th December, again we put him. And you see, it is now 91%. I told you more than 90%. He had come with 91% time in range without any medication. But still I told him, you should be on treatment. See, your post-dinner sugar is still very high. You are not doing good. I think you should be at least on metformin, because being a doctor, you always want to push him on a medication, which I tried my level best, but he was not. No. So now what you want, doc? I told you continue to do the same thing aggressively, but I am sure you will not be able to do it. And let me see you again after 3 months. There is no point of seeing you again after every 14 days. The same lifestyle which you are doing, and now make sure that your dinner which you are eating sometime outside, you stop eating and continue to do all those things. See, he came after 3 months exactly. And see the report on 5th March 2025. He came with an HbA1c of less than 6. From 9, he had come to my clinic with HbA1c higher than 6. I put him on again CGM just to convince himself and myself both, and see the report. 96% time his sugar is report normal. 96% he has done with the lifestyle modification. But what he told me, this is all because of continuous glucose monitoring. I was monitoring my sugar continuously, and that had helped me a lot. Actually, I had not shown in between reports. He was using continuous glucose monitoring continuously. He has not missed any time. He just wanted to see that how much he can reduce his weight. He reduced in 3% of his weight, which is almost 12% of his weight, without any medication, neither on metformin nor on SGLT2, and only lifestyle modification, and only motivating factor was his continuous glucose monitoring. So with a 9 HbA1c, with whatever guideline which we are talking of, this guy had changed his lifestyle so much so that his HbA1c is now less than 6 with 96% of time in range. So the effect of patient-driven lifestyle modification using intermittently scanned continuous glucose monitoring in patient with type 2 diabetes. This is a data from an open level, a patient-driven study. And this is why I am showing you this paper, because I had shown you case where only the patient was the driving force. He himself was doing all those things. And there is a paper also which is published in Diabetes Care in 2022. And that says the same thing. If patient changes his lifestyle, he can change everything, and that is what he has done. Let me show you this patient with already 92% of the time he is in range of the 92%. And we wanted to have him a better control. sorry, this is the one, the same patient had come with one more report after 3 months with a 92% report. Sorry. Now, this is one more case which I want to show. We know that if any person comes to you with a HbA1c of 9 or 9.2 or 8 or 8.5, we normally ask the patient that we have to change your therapy or we have to add you something else. This patient who was on a triple drug therapy with A1c of 8. Now all of you agree that someone is a triple drug therapy, as per the international guide it should be insulin, but I know we don't want to start the insulin with the 8 HbA1c. At least you want to control his post-meal sugar, because that is what Monier et al. Slide is. If your HbA1c is around 7 to 8.5, it is the post-meal hyperglycemia which is the major contributing factor for their uncontrolled sugar. So we explained the patient and we started him on a AGP. This is an old patient. So ambulatory glucose profile, which is a blinded one, which we had used in this Libre. This Libre patient, after 4 days when patient had come, we could see here all post-meal sugar are high. So we explained the patient that you need at least alpha glucosidase inhibitor, you change your lifestyle, you change your diet, your everything. Patient had come again after 4 days, you can see only post-breakfast sugar is high. Now many of us, we believe that breakfast should be your most important meal of the day. You should eat maximum, but it is the post breakfast sugar is always remain very high, even if you take small amount of carb. And I started talking to my patient after the seeing multiple reports of continuous glucose monitoring in last 10 years, that it is your post breakfast sugar increases maximum, so please avoid carbs in morning time. If you can avoid, try to take only sprouts or protein. That will be the most effective to control your post-meal, post-breakfast sugar. And this is even patient was doing everything. He could control his post-lunch and post-dinner, but he could not do his post-breakfast. And that is what we had asked him. And you can see in last 6 and 7 days, because of his change in breakfast, he could change his all the sugar report, which is more than 90% of the time his sugar is report controlled. And HbA1c had come from 8 to 6.8. So that is what a lifestyle modification can change the thing. This is a patient, actually you can see here, this is on a Libre view, it's a continuous glucose monitoring, and this patient was really, you can see that one day the sugar all reports are very high. The other day report is early in the morning, actually patient is getting hypoglycemia. So a CGM of a 2 different day, on a Sunday and a Monday, the things were completely different. The early in the morning from 4 to 6 a.m. or 2 to 6 a.m. other day sugar was getting down and other day it was high. Normally in type 2 diabetes you will not see such type of reports. So there is a possibility that on Saturday evening patient might have forgotten his some long acting drug, or there is a possibility that on Sunday evening either he has taken something else or extra to control his fasting glucose level. So I mean, just by seeing a 2 days report, you can decide there may be some, maybe, yes. But what modification which we have done? So after explaining the patient that your sugars reports are very high, let us do something more. And we had not changed anything except the diet, and explaining the patients on a previous 2 days report. Why we had explained this? Because actually patient was not on insulin. He was not even on sulfonylurea. Patient was only on metformin, SGLT2 and DPP4 inhibitor. So I explained that your sugar is not like this. If you want, actually you can get very good control. And that's other day your sugar is getting down almost up to 80-90. So you need only a lifestyle. And in 5 days, I mean, to our surprise, you can see the same patient in 24th and 25th I had shown, in 29th and 1st March report, absolutely flat. Sugar is absolutely normal without any issue, and that sugar report had come. That guided, why? Because of continuous glucose monitoring. One more patient, uncontrolled diabetes with A1C of 7.6, long-standing diabetes on quadruple therapy, all lifestyle modification measure is done. Now with a 7.6, how many of you are confident to start some patient on insulin therapy? 7.6. With quadruple therapy, now guideline will say uncontrolled diabetes patient with more than 3 drugs should be on insulin. And I'm sure before 2015, when we were not doing continuous glucose monitoring, what will you say? Either you can wait for another 3 months. Okay, after time, that's what we can say. Patient was not ready to take the insulin, intensive lifestyle modification. Rather, patient was getting hypoglycemia with all those 4 drugs also. So it was not like that the patient sugar was uncontrolled, because it was maybe hypoglycemia may lead to early morning hyperglycemia. That may be the reason. So what we had changed, we had decreased the dose of medication. Forget about the increase in the medication. It was because of continuous glucose monitoring. Here you can see middle of the night, completely the sugar was normal. It is just post breakfast, which was very high, maybe early morning hyperglycemia peak. So we changed the lifestyle. We decreased the dose of sulfonylurea this patient, and it really helped the patient, and the sugar came absolutely normal and HbA1c improved. So here we were not targeting the time in range. What we were targeting? Time below range. We were not worried about time above range. We were targeting time below range, and that is what we have done. This is one paper which we have written, time in range and frequency of continuous glucose monitoring. So many of us were thinking before a few years that our type 2 diabetes, and there is no guideline to say that type 2 diabetic patient should be continuously on continuous glucose monitor. They will not afford it also. So what should be the frequency? And this is one recommendation from South Asia, which we have written with Dr. Anup Mishra and Jyoti Dev. And we are multiple doctors across the country and internationally also, some of experts from all over the world who are part of it, that how frequently they should monitor, and preferably those who are very uncontrolled type 2 diabetic patients, maybe 1 monthly, maybe 2 monthly, or maybe 3 monthly, depending on how you convince the patient. But if patient is relatively well controlled, you may do once in 6 months, just to know the pattern. If you want to know more, then once in 3 months, otherwise once in a year also we do for some of our patients. The efficacy of continuous glucose monitoring is really a behavior changing tool in population with or without diabetes. So even those we are not with diabetes, but I had used continuous glucose monitoring multiple times just to change my behavior about eating. And I know that I am the person with IGT. If I eat simple ice cream, or if I take the simple sugar, my sugar goes up to 160, 170, 180, and that I could see only through my continuous glucose monitoring. Even your HbA1c may be coming 5.8 or 5.7. A conclusion was, in this particular study, this systemic review and meta-analysis suggests that CGM-based biological feedback may support modest improvement in health behavior that impact glycemic control in adults without diabetes or with diabetes, specifically reducing A1C and increasing time in range. And this was the study data to conclude for this. With this, I thank and I invite all of you once again in a meeting of Diabetes Technology, which is at 9 to 11 May at Jaipur. It is within 10-12 days. We already closed the registration, but those who are really keen and want to know more about continuous glucose monitoring, more about the pump therapy, we have a dedicated insulin pump school, CGM Academy, and doing a lot of technology talk in this particular meeting. So all of you are welcome for the same. Thank you very much.